overload is a real thing.
Well, we're tackling that problem head on. Today, we're taking a deep dive, a really focused look at the upcoming 2025 JDTAN Non-Communicable Disease Health and Wellness Summit.
That's intriguing.
It is. We're going to cut through all the noise and get to the heart of what this summit is all about and what it means for the future of healthcare in Jamaica.
Like a guided tour through the most important bits.
Exactly. And just so you know, everything we talk about today comes straight from JDTAN's official documentation. We've poured over it, so you don't have to.
So we're sticking strictly to that single source.
Absolutely. Our mission is to pull out those key insights, the surprising facts, and really understand what this summit aims to achieve. Ready to dive in?
I'm all in. Let's start with the basics. What exactly is JDTAN, and what's the overarching goal of this summit?
JDTAN stands for the Jamaica Diaspora Task Force Action Network. Think of it as a global network of Jamaicans living all over the world, all dedicated to using their skills and resources to contribute to Jamaica's development.
Like a global support system.
Exactly. And this summit focuses specifically on health and wellness. It's about bringing together experts, professionals, and anyone who cares about Jamaica's health to collaborate and find solutions to some pressing issues.
And the summit's theme is quite revealing. Non-communicable disease prevention and control, a global partnership for improving healthcare in Jamaica.
So the focus is on conditions that aren't contagious, like diabetes, heart disease, cancer.
Exactly. It's a huge concern in Jamaica and globally. And the theme really emphasizes this idea of global partnership.
So it's not just Jamaica tackling this alone.
Not at all. They're looking at the bigger picture, recognizing that collaboration, sharing knowledge, and working together across borders is crucial to finding effective solutions. And just for the record, when and where is the summit happening?
It's scheduled for August 13th to 16th, 2025, at Florida International University's Biscayne Bay campus in North Miami, Florida.
Makes sense. Easily accessible for a large portion of the diaspora. Now, let's get to the heart of it. Why is this summit so important? What makes these non-communicable diseases such a big deal in Jamaica?
The situation is actually pretty serious. The rates of NCDs in Jamaica are either on par with, or in some cases, even higher than global averages. It's a significant public health challenge.
Wow, those are concerning statistics.
They are. And Dr. Angela Wright, the co-chair of the Health and Wellness Leadership Team, puts it very powerfully. She calls NCDs a silent epidemic that disproportionately affects developing nations like Jamaica.
I see. It's not just a health issue, it's a matter of equity and global responsibility.
Exactly. She goes on to say that raising awareness and empowering individuals to take charge of their health is a moral obligation. It's about more than just medical intervention. It's about social responsibility and justice.
And I imagine technology has a huge role to play in all this.
Absolutely. The document emphasizes the potential of technology to transform how we prevent, diagnose, and manage NCDs. Think telemedicine, mobile health apps, data analysis. All these tools can make healthcare more accessible and effective.
I'm really starting to see how this summit could be a game changer. So let's get practical. What can attendees expect during those 4 days?
Well, the summit kicks off on Wednesday, August 13th, with registration and a chance for attendees to network and connect with each other.
Always crucial at these events, building those connections.
Definitely. Then, Thursday and Friday are dedicated to the main sessions, presentations, panel discussions, and workshops led by experts in various aspects of NCD prevention and control. It's where the real meat of the summit lies.
So those 2 days are all about in-depth learning and strategizing.
Exactly. And then, to wrap things up on Saturday, there's a 70s, 80s themed Bon Voyage event. A bit of fun to celebrate the connections made and the work accomplished.
A little bit of fun to end on a high note.
Absolutely. Oh, and I should mention, they're also calling for abstracts for poster presentations. The deadline is March 28th, 2025, so if you're involved in NCD research or healthcare innovation, this is your chance to share your work and contribute to the conversation.
A great opportunity to showcase expertise and get involved.
Absolutely. And Dr. Leo Gilling, JDTAN's chairman, really emphasizes the urgency of this summit. He calls it critical in addressing Jamaica's and the Caribbean's growing health challenges.
He's not sugarcoating the situation.
No, he's not. He stresses the importance of bringing together global experts, professionals from the diaspora, and local stakeholders to find those innovative solutions that can truly make a difference. It's about saving lives and improving the well-being of entire communities.
The stakes are definitely high. So let's dig into the specifics. What are the key areas the summit will be focusing on?
The document outlines 7 central themes, each addressing a different aspect of healthcare in Jamaica as it relates to NCDs.
7 themes, that's quite comprehensive.
It is. So first up is strengthening healthcare infrastructure. This theme focuses on addressing those gaps in Jamaica's healthcare system. Things like the availability of hospital facilities, access to essential medical equipment, and reaching those in remote areas. It's about using the expertise and resources within the diaspora to improve those fundamental aspects of healthcare delivery.
Addressing the foundations, making sure the basic resources are there.
Exactly. Next is telemedicine and digital health solutions. This theme is all about harnessing technology to improve access to healthcare, especially for people in underserved communities.
Using technology to bridge the gap.
Exactly. Think about things like implementing telemedicine platforms, training healthcare professionals to use those digital tools effectively, and partnering with diaspora members who have expertise in the tech sector. It's about bringing healthcare to people wherever they are.
That could be revolutionary, especially for remote areas.
Exactly. The third theme is chronic disease prevention and management. This one is really crucial considering the high rates of NCDs we talked about earlier.
So how are they tackling that?
The focus is on sharing best practices in prevention, launching public health campaigns to raise awareness, and developing effective programs for early detection and management of these chronic conditions. It's about both preventing these diseases and providing better support for those who are already living with them.
A two-pronged approach. Makes sense.
The fourth theme is mental health awareness and support. It's great to see this being recognized as a key component of overall health.
Mental health is so often overlooked.
It is, and it's so important. This theme aims to address the stigma surrounding mental health, improve access to services, and integrate mental health care into primary care settings.
Making it more accessible and less taboo.
Exactly. The fifth theme is all about diaspora engagement in healthcare delivery. This is where JDTAN's unique strength really comes in.
So how are they leveraging the diaspora in this area?
They're encouraging healthcare professionals within the diaspora, doctors, nurses, specialists, to contribute their skills through medical missions, knowledge sharing, and capacity building within Jamaica's healthcare system. It's about creating structured programs for both short-term and long-term engagement.
Tapping into a global pool of talent and expertise.
Exactly. Now, shifting gears a bit, the sixth theme is nutrition and wellness.
Focusing on prevention through lifestyle changes.
Exactly. The goal here is to promote healthy lifestyles, combat lifestyle-related diseases, and empower individuals to make healthier choices. Think community nutrition programs, fitness initiatives, educational campaigns, all geared towards prevention and overall well-being.
That's a holistic approach. And what's the final theme?
The seventh thing is collaboration and partnerships. This one really ties everything together.
I can see how that's crucial.
It is. This theme stresses the importance of building strong partnerships between the diaspora, the Jamaican government, the private sector, and international organizations. It's about creating effective frameworks for collaboration that are aligned with Jamaica's national health priorities.
Ensuring everyone is working together towards a shared goal.
Exactly. So, with all these discussions and collaborations, what are the tangible outcomes they're hoping to achieve?
What's the bottom line?
The document outlines 3 key expected outcomes. First, increase awareness within the diaspora about the health challenges and opportunities in Jamaica. Second, resource mobilization securing funding, medical equipment, and expertise to support various initiatives. And third, capacity building, strengthening the skills and knowledge of local healthcare professionals.
So it's about more than just talk. They're aiming for real, measurable improvements.
Absolutely. This summit is about driving positive change in Jamaica's healthcare landscape.
It's an ambitious undertaking, but it seems like they've got a solid plan in place.
I agree. And it raises a broader question. What role can diaspora communities around the world play in addressing health challenges in their home countries?
That's a great question. It seems like a powerful and often untapped resource.
Indeed. And thinking about all the focus areas of this summit, which ones do you think hold the most potential for transformative change in Jamaica's healthcare? It's such a complex issue with many interconnected parts.
That's something for our listeners to ponder.
Exactly. If you want to learn more, we encourage you to check out the official communications from JDTAN or the Jamaican Ministry of Health and Wellness closer to the summit dates. They will have all the latest details.
Those are the best sources for up-to-date information.
Well, thank you for joining us on this deep dive into the JDTAN Health and Wellness Summit. We hope you've gained a better understanding of this important initiative and its potential impact.
It's been a pleasure.
Until next time, Keep exploring the world around you.
And keep asking those important questions.
Absolutely.